Hello, my lovely people. It's my hope that your day is a fantastic one, and mine too is fabulous. May I start by welcoming you back to this session, whereby each and every day we give you educational bangers as per your requests, and as we promised, or as I promised when I started this channel, I will never get tired educating new people on the common conditions which affect humankind. So, if you are there and you have not subscribed, you are really missing a lot. You are really missing a lot. Make sure you subscribe, like, share and comment on our videos so that this channel may grow to greater heights and that we may continue giving you these educational bangers which will help you in one way or another in your life. And after subscribing, don't you forget to put the notification bell on so that whenever I upload a video like this, YouTube will automatically notify you and will never ever miss any of our content or any of our educational bangers. Let's get back to our topic whereby we have been discussing about bone lesion biopsy. And in our today's topic, we'll be discussing, no, not bone lesion. We are discussing about lung needle biopsy, lung needle biopsy. And today, we'll be seeing how to prepare for a lung needle biopsy. Generally, or in usual circumstances before any procedure, which might be invasive, or whichever procedure, there must be some preparations for the patient. So, how to prepare for lung needle biopsy? How to prepare for lung needle biopsy? Make sure you tell your doctor whether you are pregnant, you may be pregnant, or you have had any recent illness. How to prepare for lung needle biopsy? Make sure you tell your doctor whether you are pregnant, you may be pregnant, or you have had a recent illness. Also, tell your doctor about all of the medications you are taking, both over the counter and prescription drugs. Make sure you tell your doctor whether you are pregnant, you may be pregnant, or you have had a recent illness. Also, tell your doctor about all the medications you are taking in, both over the counter and prescription ones. Let me repeat this one again. That make sure you tell your doctor whether you are pregnant, you may be pregnant, or you have had a recent illness. Also, tell your doctor about all the medications you are taking, both over the counter and prescription ones. You may be told to avoid taking some medications for a period of time before your procedure, including the following. You may be told to avoid taking some medication for a period of time before your procedure, including the following. Number one, non-steroidal anti-inflammatory drugs, or NSAIDs. Non-steroidal anti-inflammatory drugs, or NSAIDs, such as brufen and aspirin, because they might have some effect on the preparation for this procedure. Number two, you may be told to avoid taking blood thinners such as warfarin. Some blood thinners such as warfarin. A point to note, someone from the facility where you have the biopsy will call you before the procedure to confirm the time and location. This is a preparation before a lung needle biopsy. You may be told to avoid taking some medications for a period of time before your procedure, including A. Non-steroidal anti-inflammatory drugs or NSAIDs, for example, brufen and aspirin. B. Blood thinners such as warfarin. Blood thinners such as warfarin. A point to note: someone from the facility where you will have the biopsy will call you before the procedure to confirm the time and location. Someone from the facility from where you will have the biopsy will call you before the procedure to confirm the time and location. How is a lung needle biopsy performed? And sorry, before we go to that topic, another point to note: you may be told to avoid eating or drinking for at least 6 to 8 hours before the biopsy. This is what we call fasting before any surgical procedure. You may be told to avoid eating or drinking for at least 6 to 8 hours before the biopsy. I hope you get that. You may be told to avoid eating or drinking for at least 6 to 8 hours or to fast before the biopsy. This helps to avoid regurgitation of intestinal fluids or intestinal substances, which is the food you have eaten. It can regurgitate while you are undergoing this procedure, and it can be dangerous because it can suffocate a client and cause death. That's why most of the patients are always told to fast 6 to 8 hours before any surgical procedure, so that the stomach might be empty to avoid regurgitation. How is a lung needle biopsy performed? How is this procedure performed? Because it's a delicate one. Remember, the lung is one of the delicate organs of your system, and it's one of the most important organs for your day-to-day life. And remember, this procedure is something that will be going to the lung direct. So the performance, or how the procedure is performed, should be done in a delicate way. So, how is a lung needle biopsy performed? A specialist known as an interventional radiologist, usually performs the biopsy with an aid of a CT scan, all other types of scans. This is very important. A specialist called or known as an interventional radiologist usually performs the biopsy with an aid of a CT scan or other types of scan. So these scans, one, helps him or her to locate where the specimen is going to be extracted. So a specialist known as an interventional radiologist usually performs the biopsy with an aid of a CT scan or other types of scans. Let's talk at the preparations before the biopsy. The radiologist indicates the exact spot where the needle should be placed by drawing on your skin with a marker. Before the biopsy, the radiologist indicates the exact spot where the needle should be placed by drawing on your skin with a marker. Remember, this can be done anywhere. You may have an intravenous line inserted into a vein to deliver sedative to make you sleepy. This procedure may be done when you are sleeping. So for you to get the sedative or the object that will make you sleepy, you may need an intravenous line in your vein, or what we call a granula. So the radiologist indicates the exact spot where the needle should be placed by drawing on your skin with a marker. You may have an IV line inserted into a vein to deliver the sedative to make you sleepy. A technician or a nurse helps you get into correct position. A technician or nurse helps you get into correct position. They clean the skin over the biopsy with an antiseptic and inject you with anesthetic to numb the area, and this may sting. A technician or nurse helps you get into correct position. They clean the skin over the biopsy with an antiseptic. Why do you clean? Because during the procedure, you may carry germs from the outside area to the inside area of the lung, which is very sensitive. So a technician or nurse helps you get into correct position. They clean the skin over the biopsy with an antiseptic, and after cleaning the area with an antiseptic, they inject you with an anesthetic or anesthesia, a local anesthesia, for example, lignocaine, to numb the area, and this may sting. Numbing means making it pain-free, and this may sting. This marks the end of our video today. Thank you for your time. Thank you for following me. Thank you for the subscriptions. Thank you for the comments. Thank you for the likes. Thank you for everything. Let's continue subscribing, sharing, and liking our videos so that they may reach as many people as possible. Have a blessed day.